So today I'm here to talk about what a cancer patient looks like. I've seen a lot of videos on YouTube and Facebook, and I've seen movies where they depict cancer patients as really sickly and weak and stuff. And I'm not gonna say that that's not what it's like at all, because mine is just my story and those I've come in contact with. And cancer patient can look like a lot of things, because everybody's body reacts to the chemo and the treatment differently. What I'm saying is my experience was not like that, but that does not mean that I was not feeling miserable. So yes, so far you guys have just seen me with makeup in my previous video and this one, and my skin is not this flawless. And I wish it was. It used to be. But it's not anymore, not since chemo. And well, today I am going to reveal what I look like without makeup or without a headscarf. There's nothing in here. Sometimes, people who wear headscarves with their hair, they would have like a bun or something in here. Nope, this is all empty. I will show you that when we're done with the makeup part. I don't have any hair left. I also got really swollen, and you can still see it, here. This is just fat. Yes, it is. But in my cheeks, my round face, it's not normally this round. Not, at least it wasn't right before chemo. I can show you some pictures. Right here, or ones. Yes. So right now I'm wearing foundation. I'm wearing eyeshadow. I'm wearing lipstick. I'm wearing lots of makeup right now. So I kind of seem a little normal. At least I do it to feel a little normal, and I do. But here we go. And normally I use wipes, makeup removing wipes, but I just ran out and I forgot to go to the store, so I'm just gonna be using paper towels with water. Okay, so okay, here we go. So this is just a wet paper towel that I'm gonna use to remove my makeup. There's a lot of side effects that come with having chemotherapy. The biggest one, as you'll hear the most of everyone, is the hair loss. The hair loss doesn't just affect your head hair. It will sometimes affect your eyebrows. I have no eyebrows. I also have no eyelashes. The other thing that that chemo will affect is your skin. There's these things called that I've heard people call chemo burns, and it's a pigmentation of the skin. It's a pigmentation of the skin, and it's not pretty. Think of it as closest thing I can relate it to is age spots, and that's what these are. You can see it as I get closer to the camera. You can see it right here. It was worse. I have recently started using I have recently started doing facials on my skin, and they are getting lighter. But these were pretty dark. So dark that in the first video that I posted, before I started doing the facial masks. You can actually see it through the makeup. But yes. Wow, eyeshadow is really tough to get rid of when you don't have the makeup removing wipes. I didn't know that. But yes. So I also want to go over some care tips for if you are someone who is going through cancer treatment. These are some tips that I got from a dermatologist as well as from my nurse navigator, as well as other people who have gone through this on Facebook, and they recommended some things. It's all gone now. There. Alright, that's perfect. That's a good, what do you call it? Substitute. And I'll tell you what I just used. It was actually part of the things that I've been using all the time. So what I have been using up until now was just regular makeup remover wipes. And then, because I don't like the way my face feels after I use the makeup removing wipe, is I wash my face. I don't know if, I've never really had a skincare routine before. So this is new to me. This is really new to me. Before that, I just had, if I acne here and there, but before cancer, I was really low maintenance. I just washed my face with water, and went to sleep and woke up and take a shower and put some lotion and eyeshadow and call it good. And I was a happy girl like that. Never really had a skincare routine, a makeup routine, or anything of that sort. If anything, that's one thing that cancer brought to my life. So yes, cancer has brought a nightly skincare routine to my life. So yay, thank you, cancer. Anyway, I'm gonna keep talking about some of these side effects. So now that it's clean, I'm gonna get closer to the camera now. You can kind of see these. You can see these chemo burns more closely. They're just pigmentations. If you see darker spots, kind of like that one or that one, you can see I've had some acne breakouts, and that's what it looks like after. So yes, that sucks. Also, I'm swollen. I'm swollen everywhere, and I'm gonna get closer now because you can see that in my eyelid. It looks my eyelids constantly look like I've been crying all day. So there it is. I don't know if you can see that right now. They're a little less swollen now than right after I get chemo, but they are swollen indeed. I can always tell because one thing that I have always worn was eyeliner, and it used to be super easy to put that on, or at least know where to put that on, just above your eyelashes. And I don't have any more eyelashes. Huh? See? No more eyelashes. No more. I think I have like maybe 2 over here, something like that. Couple over here. See that? There's one. I have 1, 2 hairs in my eyebrows, and yeah, that's pretty much all the hair I've got left. All over my body, actually. So another good thing, I'm always one to look at silver linings. Another good thing is that I haven't shaved since I started chemo treatments. And that's been several months. I do not miss shaving. I hated shaving before, so yeah, that's a good thing. So yes, that's some of the things that you've got for. One thing that you've got to look forward to is so chemo burns, losing your hair, up here, losing your hair here, and in your nose too. That hair is gone. I'm not gonna show you up my nose because that would be weird and gross. So we're not gonna go there. But yes, this is what a patient looks like. In my worst days, I look a little more puffy, rounder face. I do not lose color. I do not. This is probably as pale as I've gotten. I don't get the pale and red eyes. I haven't gotten that. I don't look sickly. And nowadays they have quite the cocktail of medications, so that once you go home after chemo treatment, you're not hugging the toilet for days and days on end. Through my treatment, I think I've only gotten that sick maybe, I don't know, 3, maybe 4 times. Other than that, it's just been dealing with the nausea, as well as the fatigue. The fatigue has hit me probably the hardest. A little bit of chemo brain, it's very real. Sometimes I'm like having a conversation and I'll stare you dead in the eyes and stop talking because I'm just gone. I had trouble finishing my sentences sometimes because I would forget words and I would just stare up in the ceiling trying to think of a word that went there, and it's something like, I don't know, cup. It's not even like some fancy word I'm trying to think of. But yes, there's also the stuff like in your nails. I've heard of people who have lost their nails. I haven't lost my nails, but I did get this like dark brownish, grayish stuff that goes all over. It looks like, I don't even know what it looks like, but I've gotten that. The most recently what I got is these red spots too. I'm not sure if you can see that. Let's see. There's like a red spot right there on my nail. And I've been getting those as well. But my nails have been very flimsy. Easily, I will break them easily. What else? Oh, I've gotten these like pigmentations in my hands as well. You can see them in my fingers right there. Let's see if we can focus that a little bit. There we go. A little bit. So they're just right there. It's right there as well. It's over here. Yeah, I don't know where I get that from. It's the chemo. It's the chemo. I just blame everything on chemo nowadays, but I've confirmed it with my doctor. He said that's normal and it's chemo. So it is what it is. Also, I don't know if you can see this on camera very well, but my hands are really yellow. Like right here and here and here. You can see the contrast with the tip of my fingers, which are still pink. My hand used to be all pink that way, and now this is all yellow. So that's another really another fun side effect of chemo. Other than that, the last thing I'm going to show you now is my hairless head. Alright, here we go. Ta-da! This is my head without a headscarf. I sometimes use wigs as well to hide. I'm gonna see if I can get close to the camera, and you can see there's some pigmentation in my head as well. The other thing, and I don't know if I can show you with my camera very well, is that hair doesn't fall out completely. Like if I had left this longer, you can see that I have like, you know, 2 hairs here, another hair there, another hair right here, you know, just like sparingly. I've kept a couple of threads of hair, and I'm done showing you my my head. So yes, that's what a patient looks like. This is me. This is me going through chemo treatment right now, and it's hard to show you because I also have to see this video a lot to edit it and post it, and then once I post it, I just knowing that it's out there, it's hard. It took me, I would say, after I lost all my hair, it took me at least 2 months before I would let my boyfriend see me without a headscarf or a wig. It wasn't easy. I was really embarrassed. I feel like without hair, my face looks more round, and then on top of that, I'm swollen, so it's more round. That sucks. But as you can see, my spirit is intact. I thank God every day for my family who has rallied behind me, for my friends who I have found who my real friends are through this illness and through this journey. I thank God for my boyfriend every day. And yeah, so moving on, skincare or care tips. So if you're gonna be going through chemotherapy like I did, and I went through Taxol and AC dose stands for what they call the Red Devil. This is what's going to happen to you. And one of the things that you can do to help take care of yourself is, for one, personal hygiene is of the utmost importance now more than ever, because you're so susceptible to infections from anything. You know, gingivitis is probably the easiest thing you could prevent, and that your body normally would prevent without any additional help. And you know, now that you are going through this treatment, it's not so easy. You could get gingivitis just from not brushing your teeth one night, I guess. I don't know. I haven't gotten it, so I can't speak from experience there, and I'm not a doctor, so I can't speak from knowledge there. But just brush your teeth. There's a salt and baking soda mix mouthwash that you should do. It's about 4 to 6 ounces of warm water with a teaspoonful of salt and a teaspoonful of baking soda. Just swirl that up and swish and spit, and that should help prevent mouth sores. Also, you're gonna get really dehydrated, so I would recommend this so that your lips don't crack, because that is very painful. When I wasn't using this at first, even though it was given to me as a present and as a precaution, and I would get really dehydrated, and then in the morning I would smile and crack, and then my lip is bleeding. So this is wonderful. I recommend that. And for your skin, I recommend this. And this, this one. This was recommended to me by my dermatologist. This has been a godsend because, like I said, you will get dehydrated. And your skin will feel dry. Even if you're drinking as much water as they tell you, your skin will still get so dry and itch and stuff. And this stuff is amazing. Also, to go along with that, I also use this. Like I said, like I was saying before, normally I use makeup remover wipes to remove makeup. But even then, I still wash my face with this first. I mean after, and then put lotion before I go to bed. And in the morning after I shower, that goes all over. And it helps so much with the itchiness, because if on the mornings, on the days where I would forget, yes, my skin would be so itchy because it was so dry, and you could see it. Like you could see the fibers in my face just stretching. Like, oh, feed me water, give me lotion, something. Also, the ingredients in this stuff are the same ingredients that I found the face masks. I found a face mask with the same ingredients as this, and that's what's been making this clear up, even though I was still going through chemo, because these were a lot darker before I found those face masks. Yeah. So, definitely recommend both of these. So, yes. Well, that's all I've got for today. And, thank you for watching my video. I hope you liked it. If you have questions, please leave them in the comment section below. I would love to read them and answer them. And if you want to reach out and have questions about chemotherapy or my experience with it or my side effects or anything like that, I would love nothing more than to answer those questions, because that's pretty much the only thing going on in my life right now, because I'm not working. I'm just focusing on this treatment and trying to get better. So please reach out to me via the comment section below. And thank you for watching my video. Have a great day.